Welcome to Ideagen TV, the Global Leadership Summit. We welcome today Meryl, co-founder and chair of the Global Alliance on Women's Brain Health, and also co-founder of UsAgainstAlzheimer's. For more than a decade, Meryl has served as president and CEO of the Jeffrey Bean Foundation Alzheimer's Initiative, a catalyst funder targeting early diagnosis and preclinical AD research to modify disease risk. She has also served in the bipartisan Alzheimer's Study Group, charged with presenting a national strategic plan to the United States Congress. Meryl, as one of the first women in business news, with a long-running debate show that examined the nexus between business and public policy. Any observations about leadership in the time of crisis? Meryl Comer, let's bring you on and answer this question.
Hi there, George. You've gone back too far in my history. I have interviewed many of the great business leaders of our time, even the 20th century business leaders. And the great leaders always seem to share one trait that always fascinated me, and that was their management style. Whether they were entrepreneurs or stewards, they were always agile, innovative, focused on the future, and always made certain that their companies or organizations were honed as much as is ever possible to really respond to any yet undefined crisis on the horizon. That was true with Johnson & Johnson, with the Tylenol. That was true with the formation of companies like TRW, whose leader, I interviewed him first when he was 95 and again at 101. And he was still going strong, had not missed the office for 75 years. So there is something about that tenacity and focus that you'll also hear in our interview later. It's also why our next leadership conversation is right for the times. In the midst of COVID, came an announcement from Davos, Switzerland during the World Economic Forum's meeting just this past January of the Davos Alzheimer's Collaborative, or DAC. It's a new global pre-competitive alliance incubated by the World Economic Forum and the Global CEO Initiative on Alzheimer's. Joining us now are two leaders who have marshaled the moment to not only take on this project around the next pandemic, but to grab the action now. Joining us now are two leaders who have marshaled the moment to not only project the next pandemic, but to take action now. They are the co-conveners of the Davos Alzheimer's Collaborative, or DAC. Arnaud Bernaert, head of Global Health and Healthcare and member of the Executive Committee of the World Economic Forum, and George Vradenburg, co-convener of the Global CEO Initiative on Alzheimer's disease and chair and co-founder of UsAgainstAlzheimer's. Welcome, gentlemen. Arnaud, I'd like to begin with you. Under the World Economic Forum's leadership, you've mobilized the public and private sector to respond to the global pandemic. What are the key lessons learned during this crisis and the takeaways that can be deployed as we try to head off the next pandemic?
Thank you very much, Maureen, and nice to see you, George. We see each other almost every day these days. So, Maureen, I think fair to say that what we have seen happen during that past period has been exemplified by very, very robust initiatives and successful ones like Warp Speed in the US. On our own end, we launched almost day for day, 1 year ago, our COVID action platforms at the World Economic Forum, an instrument meant to galvanize public sector and engage them into solution making in public-private partnership. During that period, more than 1,200 global leaders have engaged, 700 companies, and making offers to collaborate in support of innovation in the response to the crisis, with more than 40 individual initiatives being advanced. I could name a few of them: 3D manufacturers reassembling and ventilators based on specs being shared by originators, or polishing and perfecting non-pharmaceutical interventions guidelines in Africa, together with Ipsos, the African CDC, resolve to save lives, to benefit 40 countries in the implementation of better measures. So I think, we knew that because we are, in a way, as World Economic Forum, the global institution for public-private collaboration. We knew the strength of public-private collaboration, but we have seen that exemplified and multiplied by many-fold during the current period.
Thank you. George, the world is suffering from COVID fatigue, but we already know that there is the slower, more insidious pandemic on the horizon. It's already going after aging populations. What are the challenges and any data that's predictive of Alzheimer's as the next global pandemic?
Well, I think there's not much question that Alzheimer's is now a pandemic scale geographically and in terms of prevalence, a geographic and prevalence pandemic. 50 million individuals with Alzheimer's estimated today. But as we know from this disease, it's a family disease because loved ones and caregivers in the family are engaged in taking care of and providing safety and help for that to the person with the disease. So 50 million individuals turn into 50 million families, which turn into 150 to 200 million people touched today. Estimates are that those numbers will triple by 2050. 150 million people, 150 million families, perhaps 500 million people. And the economic cost to the globe already estimated at 1.3 trillion a year in terms of cost, rising, doubling every 10 years, 2.5 billion a year in global costs in 2030, and again, rising to 5 billion in 2040. So this is a pandemic scale disease in terms of prevalence, in terms of cost, in terms of social impact on the people of the world. 2/3 of the cases are in low and middle income countries, and that percentage is rising as aging demographics hit the large populations who are located in China, India, Indonesia, Nigeria, but the low and middle income countries.
So the question really to both of you is the Davos Alzheimer's Collaborative is a partnership. So let's dissect the relationship. How did it come about? Who pushed whom? And what niche and gaps are you trying to fill? Arnaud.
Well, obviously, I mean, we working in public health, we are very well aware of the dramatic situation that's unfolding, and the fact that if nothing is going to be done, it's going to be a global catastrophe. That's something that we have discussed in multiple instances with our friends at WHO, the ones running the mental health agenda at WHO, but also multiple partners from the private sector. I'm thinking about the likes of Biogen or Otsuka or AC Immune and many others that are currently having in the portfolio submitted from time to time for FDA approval disease-modifying drugs. And they are very worried in a way because when those drugs could make an impact and make a difference for patients, I mean, they are very worried that healthcare systems are not ready. And there is a considerable investment to be made in that particular area. So the rest is history, because obviously we've been guided at that point in time to talk to George, and George flagged additional opportunities when it comes to building better analytics, global core platforms, more diverse genomic profiling type of initiatives, and also the opportunity to actually accelerate clinical trials by providing solid platforms to innovators. So the three ideas emerged as priorities very early. Over to you, George.
Well, Bernaert called us, Arnaud called us and said, we'd like to partner with you. Would you be interested? And we said, of course. We did some interviews because it was one of our first priorities is that we not duplicate any efforts. So what could be done in this space that hasn't already been done? And one of the two key takeaways from that analysis is, as Arnaud articulated, the fact that low and middle income countries have not had a disease infrastructure, a research infrastructure for discovery. There are isolated pockets and cohorts around the world that are focused on this, but in fact, they had not been brought together. So part of this is a focus on low and middle income countries. If we want to address the global pandemic of Alzheimer's, we have to address it at a global level and not just a wealthy nation level. 90% of the efforts in genomics have ignored low and middle income countries. So let us link that. So the second theme was linking and scaling existing efforts. So with new data sharing techniques, with new digital technologies that are capable of understanding the clinical progression of this disease in populations using smartphones and other digital technologies, we thought we could bring new technologies to this issue that are lower cost, much more accessible, and we could link these cohorts around the world through that effort, and with clinical trials that we could basically take from where they exist today, which is largely Europe, United States, and Japan, and take those global as well. And as Arnaud pointed out, if we get some disease-modifying drugs and they're safe and effective drugs, how do we get them to everybody around the world rather than just the wealthy nations? As we've seen with COVID, we underweight the huge populations of the world that are experiencing these health problems. Let us think up front on how we bring those low-income, middle-income nations into full partnership with the rest of us to get universal access to medicines when they emerge.
Now, the global costs of Alzheimer's are already estimated to be around $605 billion US dollars. That's approximately 1% of world gross domestic product. What are the projected costs to get this type of project up and running?
Well, Arnaud and I are looking at what we have estimated over the next 6 years to be about a $725 million effort. And Arnaud can scale that to compare it to his prior incubated global mechanisms in infectious disease areas. But it's a very large budget that will require us to seek funders in a wide variety of sectors and a large number of funders in each of those sectors, so that no one entity, no one organization, no one government has to bear all those costs. But we anticipate if we can demonstrate in the next 4 to 5, 6 years that we have an operation that can be stood up, that can operate and really deliver on the promise of faster, less expensive, and more accessible cures, we think that this can be a continuing effort through time.
Arnaud, anything to add to that?
Well, I would add that not only this, but this is also a remarkable investment for the world to make. I would like to draw a parallel, indeed, George, to the moment in time where the World Economic Forum in 2016 was incubating CEPI, the Collaboration for Epidemics Preparedness Innovation. And interestingly, as we worked for the full of 16 to prepare for CEPI to be launched, and we launched in Davos in January 2017, we raised at that point in time approximately the same amount, 750 million for the first 5 years. Now, look into what CEPI has done this year only. It has invested into no less than 9 COVID vaccines very, very early in the crisis. And even more importantly, and that's maybe less known, but a lot of what we knew back to January of 2020 on coronavirus was because some of those 750 million were precisely invested in the understanding of spike proteins mechanisms in the context of MERS or SARS-1. So, good investment if you think about what arguably CEPI has saved the world in the acceleration of vaccines getting them into 1 year, think about what we could do in the field of Alzheimer. For me, there's very analogous opportunities.
George, let me ask you, the metrics for success when you mount an initiative like this, how do you organize around it?
Well, we do have to set annual key performance indicators to make sure that people who are funding this effort and who are involved in it know that they're making progress against our goals. So with respect to each of our programs, and Arnaud outlined them, global cohorts, global clinical trials, and health system change, that we are going to set annual metrics against our long-term goals. The goal is to move medicines more rapidly through the pipeline of research and clinical trials in humans and into clinical practice. Do it faster, do it less expensively, and make sure that everyone gets access. And if you measure those 3 or 4 propositions and then set a goal each year to know that you're on schedule and on pace, then we know that we can accomplish our goals.
I know, because this is a leadership conference, the World Economic Forum assembles nothing but leaders in Davos. From your observations, what style of leadership is most effective in that environment and obviously needed for an initiative like DAC to succeed?
You know, the leaders that are coming to Davos, they are the leaders that share some of the values we stand behind at the World Economic Forum. And by the way, interestingly, in the current year, we have seen our partner base increase, meaning that those values actually are even more important than they were in the past. And I mean collaboration, courage, commitment to equity, and also from time to time, willingness to compromise, because making those public-private partnership happen is tough. Everybody has to give a bit. If you want to promote affordable access, you know, from time to time, you need to be flexible in the adjustment of a business model, and you need to get closer to civil society and their demands. So that willingness to compromise is certainly not to be ignored. Interestingly, you have a great leader with George, and that's where I would add only one dimension. This is courage and tenacity.
He says the same about you, Arnaud. George, your story goes, and in all transparency, I know George Vradenburg quite well. I have followed him for many years as an advocate, but a successful businessman in retirement takes on an issue personal to his family, a disease with no cure, Alzheimer's, sets a target for success, engages a core of those of us who share his passion and pain, mobilizes and builds out networks, first domestically and now internationally, while moving seamlessly. I know, as I'm sure you are well aware, through politics and various cultures. So George, what in your business career prepared you for this style of retirement?
I worked in succession over about a 10-year period for Larry Tisch, Barry Diller, Rupert Murdoch, and Steve Case. So I saw the artistic capabilities of really great business executives, all with their own style. But I will put a little extra emphasis on Steve Case. He believes strongly that a corporation has a social purpose. It employs people, it motivates people, it creates wealth, it creates change in society. So he melded what had to be obviously the need for financial performance to understand how to obtain capital for what he wanted to do. But he basically led a company that had a social purpose to it. It is very much in the same vein that Klaus Schwab has now written extensively and spoken extensively about stakeholder capitalism. That in fact, we need as business executives to understand that our success is based upon solutions of major problems that we as an individual business cannot do. So taking a social purpose of the corporation, extending it to collaborations and to large-scale cross-sector collaboratives is important to enable businesses to create an environment in which they can succeed for their individual business, but at the same time that fulfill their social purpose of solving the major problems facing society. So Klaus Schwab, interestingly, different language, but the same philosophy of a corporation having a role in society and a positive role that it had to integrate into its mission.
And because you're a co-chair with Arnaud, tell us about Arnaud style, because it obviously you have to work together.
Well, Arnaud is got the same qualities he attributes to me, courage and tenacity. But beyond that, he's a servant leader. He basically is leading on behalf of the people of the world. It is not Arnaud's personal publicity that he wants. It's not Arnaud's personal wealth that he wants. He wants to achieve goals that basically serve people globally. It's part of the WEF culture, and Arnaud is a great exemplar of that culture.
Arnaud, what has been the most significant impact of major private philanthropy, like a Gates Ventures, on the global health issues of our time? And is it healthy for the globe?
They are catalysts. They are absolute catalysts. I think without the Gates Foundation, I don't know what the price would be of ARV drugs for HIV patients in Africa. Without the Gates Foundation, there would be no Global Alliance for Vaccination and Immunization. They were at the origin of that, together with others, the World Economic Forum and Norway back to 2000. But without Bill Gates and the Gates Foundation, it would not have happened. Without the Wellcome Trust, there would be very, very little progress when it comes to the combat against antimicrobial resistance. I think there has been a catalyst for this 1 billion fund that was finally landed by the industry back to November last year. By the way, Wellcome Trust was also a catalyst for CEPI, together with Gavi and together with the Gates Foundation and the government of Norway. And you know, I mean, and think about this miracle that is about to happen, and I hope it's not going to be slowed down. This is the elimination of polio. That's Rotary, largely so. So, you know, they are catalysts, they are implementers, they can have feet on the ground. What I like with the best run philanthropies is they are laser sharp focused on their goals, and they don't deviate an inch from what they have decided to do.
I'm going to ask you both, gentlemen, to fast forward 10 years from now. What predictions of success are you willing to make for the Davos Alzheimer's Collaborative that we can hold you to?
Well, I'll start, but I'd love to hear Arnaud's answer to this question too. I think we'll be on a path to preventing the symptoms of this disease. We've discovered in the last 5 years that this disease starts 20 years before symptoms appear. Average age of onset of symptoms in the 70s, that means that the average age of the onset of the disease is in your 50s. So I think that we'll be on a clear path to preventing this disease. Now, the question is, in how many people of the world? I think we'll make a significant 10, 15, 20% progress in preventing that number of cases in the high-income countries. The challenge for us is to assure that that kind of penetration of prevention, therapeutic interventions, and risk reduction strategies achieves the same result in low and middle-income countries.
Arnaud?
Yeah, I would like to tell you about our great friend Paul Stoffels, head of science and president at Johnson & Johnson. It so happened that Paul was the chair of our board of governors when it comes to health and healthcare at the World Economic Forum. And I remember, I think it was in Davos in 2019, and he said, listen, we will help you guide your program, but I want you guys to think about one thing. We have succeeded with CP. I want to start another initiative that 20 years from now, people will remember the start thereof. And I think this is it.
You know, it's hard to imagine that the World Economic Forum started in 1971. Arnaud, what technological advances excite you most attached to global health?
That's a very good question. I'm very passionate about what's happening, obviously, in the field of genomics. I'm very passionate also when it comes to technologies from the fourth industrial revolution, as well explained by our chairman Klaus Schwab. The blurring of frontiers between data, biology, robotics, it's fascinating, and I think I'm hopeful that it will make it for better access to care, universal access to care, precision medicine, better outcome, and more importantly, again, access for all.
And George, is the notion of a vaccine against Alzheimer's out of the question in your mind?
Not at all. What I described in terms of using therapeutic interventions before symptoms occur, with the view either of delaying symptoms or preventing symptoms, strategy successfully pursued in HIV/AIDS, where you can be HIV positive but never die of AIDS. That's a secondary prevention strategy. A vaccine that actually inhibits or prevents the development of the underlying pathologies of the disease is very much on people's minds, and there are already a couple of vaccine candidates in clinical trials. So time will tell on this, but no, vaccine is not out of the question, and we should be looking at primary prevention techniques in addition to what I'm characterizing here as secondary prevention techniques.
And because I'm about to invite Ideagen's chairman and CEO, George Vakakis, back to join us, I want to ask you, gentlemen, where are you most creative when you put your cell phone aside? What do you do to get where do you go for your inspirations?
Mm-hmm. Well, I go to the Phillips Collection here in Washington, D.C. It's an art museum whose board I chaired for many years. And I find this kinetic connection to great art and the contemplation of art not to be a passive activity, but one where, in fact, you are in a dialogue with somebody's story that's either on the wall or with Mark Rothko and the modernists, very much with the universal. So I go to art is where I go.
All right, George, I also know you are always have your face in a book, 5 or 6 books piled up on your desk. So what's the latest book you're reading?
I'm reading a lot on racial justice and a lot on gender justice. So clearly these issues are now bubbling up large scale in the United States. They should have been on our agenda for 400 years. We made some major errors in the construction of our democracy here and our culture. But I'm reading books about the right after the Civil War and the effort to impose on the South a variety of techniques to move citizenship, banning of slavery, equal protection of the law, and then what happened for about 100 years after that, that we did not execute on those Civil War amendments to our Constitution. So that has deeply affected my own sense about my nation and about my country, that we have a long way to go to achieve our ideals.
Arnaud, same questions.
Yeah, I think, I'm fortunate enough to live in a beautiful part of the world where hiking is quite rewarding. I think living in Geneva and being so close to Jura and the mountains is quite relaxing, and I like that a lot. It washes your brain, and if you ask me about the latest book, I mean, I'm going to be a a little bit ashamed that it's not that inspiring, but that's a beautiful book on the progress of vaccine innovation over the past decades, and trying to learn and understand how this miracle did happen, and I'm increasingly interested in understanding the mRNA action principles. So I spend quite some time in this one those days. I can tell you, but that may be too close to the professional life. So I need to find something better for the next time.
That's right. I asked the question only to point out that we have two Renaissance men on with us. Joining us now, Ideagen's chair and CEO, George Vakakis. George, are you there? I know you've been listening in, George. Do you have any questions for our CEOs?
It has been there's the book. It's a profound conversation, and it takes leadership. This is all about global leadership during this Global Leadership Summit, and I believe that we heard that today. We heard Arnaud and George. George, great to see you again. Can't wait to see you again in person. Of course, Meryl. You all are changing the world. And, I was having a great conversation during another interview with someone you all probably know, Simon Blant, who ran the UNAIDS operation at the UN in New York. And Simon is now with GLIDE, the Global Institute for Disease Elimination in Abu Dhabi. But during our conversation, he said, George, leadership when you see it, and you know it when you don't. Mm-hmm. And today we've seen leadership. And it's not about title. Leadership is about leading. It's about changing the world. And I know George Vradenburg, my gosh, you're at that pinnacle of helping to lead on this critical issue. Arnaud, what an incredible pleasure. Thank you for all you're doing at the World Economic Forum. We are huge fans. We at Ideagen amplify your content, your leadership always. And it's an incredible honor and privilege to have you at Ideagen TV today for the Global Leadership Summit. I'd like to ask George first, why is leadership so important to you? What does it mean to you?
It means change. It means improvement, hopefully improvement. There are some leaders who take us the wrong direction, but good leadership is taking us for positive change and guided by the notion that you're serving others. And the essential part of having a purpose in life and having a purpose that you can feel good about is the ability to say you're leading for a change that's positive for other people.
Yeah, Arnaud, I'd love to hear your sort of perspective on that. There's so many definitions and there's so many elements of leadership, but what is most important to you? What is that spark that drives your definition of leadership?
Yeah, getting from a community of insights to getting to a common agenda takes common sense. But executing on the agenda takes leadership, and that's really a big definition between talk shop and making a difference.
Incredibly well said, Meryl.
Thank
you led this discussion incredibly poignantly and just with class and dignity always. And my gosh, it's been incredibly insightful for me. And what hope we have on Alzheimer's, what hope we have, thanks in large part to the leadership that we have here today.
Thank you all.
George, and thank you, Meryl.
Thank you very much.
Thank you.